Dr. Evans. Mr. Meyer is in room 1. He's here to follow up on his diabetes. His blood pressure was a little bit high. It was 172/91, and his sugar was 201. His other vitals were normal. He also complained of a lesion on his toe. And we also did a PHQ-9 with him. His PHQ-9 came up to be 19, and his audit was 6.
Okay, great. I'll head in here right now. So first. Good morning, Mr. Meyer. I'm Dr. Evans. How are you today?
I'm all right, I guess.
And who's with you today?
This is my wife. She insisted that she come.
Hi.
Hello, Mrs. Meyer.
Nice to meet you.
So what brings you in today?
Well, when I checked my sugars, they've just been off. And I think part of it is, I'm missing some of my medication doses. I'm eating more sweets.
So your diabetes, are your levels have they been high?
Yeah, they've been a lot higher than they should be. Usually when I check, usually my sugars are in the 160s, but now they're in like the 240s and sometimes even the 300s.
Okay. Well, I think maybe we should try to come up with a plan to get that down.
Yeah, I think that's probably for the best.
Do you have symptoms when your blood sugars are high?
Yeah, my eyesight gets a little blurry. I just don't feel right. And I've got this weird sore on my toe that I've never...
Yes, my nurse mentioned that you had a wound on your toe. What's going on with that?
Well, it's been going on for like the past month. I've been noticing it started...
Tell her the truth.
What kind of symptoms? Are you having any symptoms? Any redness or...
Yeah, I had some
swelling
redness. There's a cut. Initially it was red, but now it's turning like a darker color. And I've never really had that much feeling in my feet because of the diabetes, but now it's like I can't feel hardly anything in that toe.
Any fever or chills with that?
Not so much chills. It's sometimes there's a little bit of liquid that comes out of it, but not enough that it's not that noticeable. I keep it.
He's been having night sweats.
Have you ever had anything like this before, Mr. Meyer?
No, this is the first time.
Okay, well, we'll take a look at that, but before I examine you, do you have any other symptoms like chest pain or breathing problems or?
No.
Okay, all right. Well, I also wanted to ask about your mood. Have you noticed any changes in your moods? Because you did on the questionnaire that we had, there were some flags that were triggered there for us.
Yeah.
What's going on? How you feeling? Your mood?
When I fill out those forms, I think maybe I'm feeling a little worse than I think I am. I'm down. I don't have the energy that I used to have, and with my diabetes flaring up, I'm not as hopeful that my health can improve.
That must be really difficult for you.
Yeah.
Have you had any increasing guilt or feelings of hopelessness?
Well, I guess I feel guilty because what I do most of the time is I just sit on the couch and I see my wife just helping out with the kids and doing everything else that needs to be done around the house, and I can hardly get up. And
Before he was very active. He always went out, he would help me around the house, and now all he does is sleep. He sleeps in late all the time. And sorry honey, but you're a little useless right now.
So Mr. Meyer, have you been on any medications before for your moods?
Yeah, my psychiatrist put me on Celexa, and I maxed that out. And then he switched me to Zoloft, and I thought Zoloft would be helpful, and he maxed that out.
What are you taking now?
I'm not taking anything.
Not taking anything right now?
Yeah.
Okay. Well, what I'd like to do is go and speak with the psychiatrist here to see if we can come up with a better regimen of medication for you. How do you feel about that?
Yeah, I'm open to it.
Okay. Well, let me go speak with the psychiatrist about what we can do to maybe help figure out what we can do medication-wise to get you feeling better.
Thank you.
Hi, Dr. Evans. How can I help you?
Well, patient who I think I need a little help with, and the therapist is meeting with him right now, and but I was hoping you could help me with him. Well, Mr. Meyer is a 44-year-old man with a history of hypertension, high cholesterol, depression, and diabetes who presents with a diabetes follow-up today.
Okay.
He used to be morbidly obese, but he's lost a lot of weight over the past year. And unfortunately, when he was heavy, he was diagnosed with type 2 diabetes about 15 years ago. He's been insulin dependent for the past 5 years. Glucose control has been difficult with his, as he often forgets. Fatigue for the past month or so. His wife said his mood has changed. He's complaining about the depressed mood. He is reporting difficulty with concentration, energy, depressed mood, guilt. He's been on max doses of Zoloft and Celexa before, and I'm not really sure where to go from there.
Okay. I think the first thing we need to look at is if he's ever been on an SNRI.
Mm-hmm.
Also, do you know how long the trials of the Zoloft and the Celexa were? And if he has had any suicide attempts or hospitalizations?
I don't know. I know that he has been on the Celexa and the Zoloft. I don't know how long the trials were. That's a good question. I'd like to also gather more information from him about that, because I'm not sure.
Yeah, that would definitely be helpful.
Yeah.
What we can do at this point is maybe try him on some FX or XR, as long as he's never been on it. And I would probably try starting him on a 37.5 milligram daily and go from there. See him back in about a month. If he's not better at that point, then we'll think about maybe increasing the dose from there. Once we increase the dose, if it's not working or if you have any concerns about that, then just schedule him to see me for a consult in about a month.
Okay, that sounds good. If he needs to see you, will I keep seeing him too? Do you want me to be following him?
I can definitely see him more as a consultation.
Okay.
I'll see him roughly 4 times unless he needs more visits. And just to keep in touch so that the transition of care can go smoothly. Okay.
Okay, that sounds good. And I'll have the therapist see him weekly for at least a few weeks to start the Effexor and go from there.
Okay.
Is there anything else?
Maybe we want to try to get a TSH and CBC, just to be sure that there's not like a medical reason for his mood changes.
Okay. Well, we did do a CBC a week ago and it's normal, but I'll get the TSH. Thanks for your help, and I'll see you at the next weekly case conference meeting.
Awesome. Hope everything works out.
Great. Thank you.